Good morning, friends. So we will start a very serious issue, serious topic, that is medico-legal aspects. So last 1 year you have been listening to a lot of sessions on medico-legal aspects, and then this is the last of the program. I have great pleasure in inviting Dr. Radha Ramanan, our past president, Dr. Jain Chiman, incoming president, Dr. Biju John, general secretary, as vice counsel in this session. It is just an interactive session, sort of panel discussion sort of thing. Anybody can disrupt me anytime. And it is all about sharing your experience, and with that we will all improve our knowledge and then have a better chance of fighting a litigation. So that is the purpose of the whole session. So Dr. Biju John, and I have great pleasure in having Dr. Ashok Natarajan, LLB, to be part of my session. I will be talking, I am not a proper legal person, I will be talking on more of medical aspects of these legal formalities, and Ashok will be dealing with legal aspects more than medical. So this is titled FAQ in medical legal cases. So first few slides I will show with some scenario, then we will have some discussion, and then we will go to Ashok's presentation. As part of KSOS President's project on improving legal literacy, I have conducted, with the help of Ashok and all, I have conducted more than 20 sessions across the state, and this will be a real world scenario. And we are releasing a book on consent book. This is a Malayalam Sammadapatram, Netra Shastrakriya Sammadapatram. We will be releasing the book today in the inauguration, and it will be available for all the members from the website. You can modify this and then use it as consent in your hospital. So consent is the most important part of procedure. So Ashok Nataraj, KV Babu sir has not come. So first case is, I will give the most dreaded case that we all face is post-operative endophthalmitis. Okay, and this has the highest number of litigations. Naturally it has to be like that because the patient has a disfigured eye. Whenever he looks at the mirror in the morning, he will curse you. So it is going to be a lifelong agony for the patient. So there is the maximum chance of litigations are in post-operative endophthalmitis. Few cases I will share, some of them. This was Najirul Sheikh versus Sumit Banerjee, 2024. In fact, the district council went against the doctor. The state and the National Consumer Redressal Forum was dismissed this plea, and finally the Supreme Court decision went against the doctor. So there are a lot of things that the Supreme Court is, they are very knowledgeable people sitting there. They will go through each and every aspect of treatment with expert opinion, and they will check all the documents, whether they have done all necessary tests, all standard procedure. So everything was taken, and then the case went against the doctor. Another case, this is State Consumer Redressal Forum versus Aravind Eye Hospital, way back in 2012. It was a CAM case, and the allegation was that pre-operative antibiotics were not given, which was well defended by the hospital, and the details of the sterilization procedure, this is important, were not produced in the court by the hospital, and unfortunately the expert witness at that time went against the hospital, saying that there was no need of cataract surgery and all. So all these 3 points we will discuss now. Okay, the compensation was awarded. So CAM case does not mean that you cannot be sued. Another case, Dr. Ramarao was a patient, and in that the case went against Dr. Veeraya, who did the surgery. Patient, he has not advised B-scan, and the follow-up was not told properly to the patient. You come on this day and have a checkup. So it was not documented. So this is the problem. So here there are some points to discuss. If you get a letter from the patient or an advocate, there are 2 types of letter you can get in the by a registered post. Whenever you get a registered post, you will be worried. So nowadays nobody sends registered post. So one patient and advocate. How will we respond to each one? I request Jain sir to give few thoughts about that. How will we reply to both of these?
The first letter you will be getting will be from the advocate saying...
Patient can also directly send you...
Patient can directly send the letter.
We are talking about notice that is sent initially. That's not a case, that's the initial stage notice.
It is not from the court. Notice? It is a letter, and so. I request, you should pay this much.
Otherwise, I will go to court like that. Yeah. So notice, how do you reply to a notice?
That is the advocate notice. Advocate will be sending a notice to you. There are two ways to respond. One is you can just send a formal denial saying that you have given standard treatment and the patient was admitted, I had given standard treatment and there is no negligence on my part. That's all that is required for replying to an advocate notice. Or second is you can all give a detailed reply showing that, citing that you have done the correct thing.
So what do you prefer, Jay?
I prefer, and IMA's stand is always to give a formal denial report, not to divulge any details.
Important points. So there are some points in that. Actually, your letter should be strong enough without divulging all the finer details so that you don't lose. So whenever you give, I have done this.
One clarification regarding that. Anyway now we are going for the IMA. We are all having the IMA professional protection. So the standard procedure is to actually get their help, and let them draft the notice.
Yes.
Right.
Drafting
draft
the notice.
Reply.
Drafting the notice. You can do either just blanket denial or with little details. See, there are two types of notice, I said. One is from the advocate or patient directly. Second is from the court when they ask for it. That time
is
we have to give the, that is a summons. You have to attend this with all the evidences. That should be
I think better not to give the whole details in the first term. Early
But
denial and some important thing.
Valiant, strong points
Valiant,
so that
strong.
some cases may not go to the court at all. So that is it.
And as Bijusan said, the reply is always sent through the advocate only. We don't have to sit and write.
Don't write reply on your own. You have to go through the IMA PP scheme and you have to sit down with the, whenever some notice comes, you take all the file or print out of all the files with consent form, all test, everything, and take a file and then go to the advocate and then he will prepare, he will go through the whole file and then step by step you have to give a good reply when there is a summons.
So there is also one, other than this thing, sometimes especially in government hospitals, we get just complaints from the patient only, not through an advocate or anything.
That's my first point.
That I think we can...
that you can strongly deny, but you should give some data. Like I have done the standard of procedure, standard protocol was followed, something like that.
I think this situation, I think if with the patient alone coming, patient is coming directly, it is a communication thing. Actually, we have to communicate very well to the patient. And there only a denial is not good because we have to convince the patient.
Yes.
That art will help the things.
Because notice is in the form of a legal format. And if you don't give a reply to the notice, finally when it goes to court, not giving a reply to court notice will be taken as a negative thing against the doctor. So that is very important.
So if the patient just writes a letter, don't give too much of details, but strongly deny. If the patient writes through the advocate, give little more strong denial, but don't divulge everything. Don't give all the investigation reports and everything. There will be some mistake, they will catch on that and when you come to the court. Third one is summons from the hospital, means you have to properly. So these are the three things, differences in reply. Okay, how to formulate a reply. Please do sit with the patient, advocate and go through each sentence word by word and then reply. That's very important. Don't allow the advocate just to give a reply on his own. You find time, it is your problem. So IMA schemes, Jane, you can highlight, all of you take IMA PP scheme and enhance the protection.
Yeah, that's what Mahesh said correctly. When you get a summons from the court, then you have to sit with the advocate and write a reply through the help of a PPS scheme advocate. Each word you have to specifically go through and give a detailed reply, because with that reply only you are going, that your advocate is going to fight in court. You cannot change your statement in the court later on. So when you are replying to a court, it should be full. Each sentence, each word should be replied. That you have to sit with the advocate, get the help of PP scheme. And PP scheme is very much beneficial to all of us. Just paying 2,000 rupees per year, you get a benefit of 20 lakhs whenever you are covered up to Supreme Court. So we have a advocate in Supreme Court who charges, for one sitting he charges 1.5 lakhs. So you just by paying 2,000 per year, you can get the advocate through PP scheme. So that's the advantage.
And one thing about the reply, see, for a notice, there is not much of a time delay. I mean, whenever you want, you can reply because it's not coming through the court. Advocate is sending. But when you get a summons, the reply should be sent within 30 days and maximum 45 days. If it goes beyond that, the case will be decided ex parte. That means you will not be heard. Whatever patient says, the court will take into consideration and pass the decision. I had one gastroenterology friend, one day morning his friend called and told him, I heard your name on TV and they have awarded 50 lakhs damage against you. Then only he is seeing the TV and finding that, because he was working in some other hospital, the summons was given somewhere else and he has actually not received it. So that is very, very important. And most of the lawyers, they will tell you about this only 2 days before the last date.
Tomorrow is the
hearing, so you please send it today, like so, that. So, you know, you have to take interest in all these things. Lawyer will not come behind you. They are not like doctors who will go behind patients and ask things.
Regarding endophthalmitis, this scenario, you should submit all the details. Like I tell you, the consent, written consent, then the full file, that full EMR or whatever printouts, then investigation, A scan, B scan, whatever you have done, even how many patients were operated that day, all other, that register copy, the NABH hospitals have that sticker, they sterilization protocols, all these things they stick in the register, copy of that, everything. Don't leave any loophole, so that none others have not had any problem that they operated, same day operated. So these are all important when you submit. So it is your idea. I mean, judge, the advocate will not ask you bring that, you bring this. They don't know anything about it. They will just, so these are some of the ideas.
Though you are denying for the first letter, you should keep ready all these things when you get the first letter. Yeah. So because as he said, you won't get time to prepare detailed letter once you get a summons from the court.
This is what Mahesh told is very important. Actually, the judge and advocates are all laymen. Actually, they don't know anything about the medical world. If you convince them with all the records, what are the precautions you take it for in an OT? So usually, that itself is convincing to a judge. So otherwise, if you give a statement just like that, say, I have done everything correct, it won't work because they won't get convinced. So this is a very good idea to have a total protocol submitted to the court.
And one thing you should understand, the district commission, the judges are, one is a retired district court judge, the other two are laymen. They are qualified people, MA graduates only. So you should not expect too much from them also. So as Radharamanan sir said, they should, I mean, even a common man should be convinced with your evidence and the information you are putting forth in your favor.
So whenever you go, you take all the sterilization data, registers, that day, the list of people operated that day, the full register, everything, NABH protocol, what you follow, keep it big strong bundle, so everything will be safe. So that is regarding one. Documents and precedent judgments, that is important. I showed few cases. 98% of endophthalmitis judgments in Supreme Court are in favor of doctors. You can just get a lot of this thing. That also you can quote during your reply. This and this. So that is all you can do. Now second topic is trauma. This is very common scenario. So most of the judgments have come against the doctors because of lack of documentation, lack of imaging, lack of follow-up advice and lack of timely referral. Okay. So for example, this case, Ravi Teja Visakhapatnam case against LVP, Visakhapatnam, they did primary repair and the next day patient was discharged in the morning, advised to come for scan on Thursday after 4 or 5 days. Patient did not come. Then he went to some other hospital and found that there is an intraorbital foreign body. And from there he went all around a lot of places and finally that eye became tricycle or something. So this, the initial thing, they, the court went against the doctor, say 15 lakhs was awarded. It is under appeal, that is another thing. But proper communication, when to call the patient, and just note that patient is advised B scan or CT scan before, next visit or something. Everything should be documented. Otherwise, this is another case. Patient had injury and emergency treatment was given and advised to go to the higher center. But the patient came after 1 or 2 days with endophthalmitis. Then he went to the higher center. But the doctor could prove that already patient came 2 days late to the hospital and he was referred, but he didn't go to the referral center early. So these things, if you properly documented and you have a referral letter and everything, this case was dismissed. Another case was Abdul Jamal case, where the patient was treated and without doing a CT scan or B scan, and was referred to Aravind Coimbatore. They found IOFB. The lapses were, there was no imaging, there was a delay in referral, and the most important, lack of documentation of, I told him to go to higher center, that is not enough. You should have documented it. So because of that expert opinion, the judgment went against. Another case where the IOFB was missed and the failure to detect IOFB was the cause for negligence, and case went against the doctor. So this is another one, bad injury, right eye injury with iron rod. They did everything, retina surgery, everything, vitreous hemorrhage, RD was there. And the case was dismissed because these are all possibilities that can happen with any injury. You can't give 100% vision in a retina detachment case after open glove injury. So, but luckily, it was all explained to the patient, written informed consent was there, this was dismissed. So, usual misses in ocular trauma, what all the misses, documentation, imaging, referral, any comments from Biju in medical college, what you have seen, experience?
Yeah, so documentation is very important, and as far as medical college setup specifically, one thing that we generally face is that, private hospital, I think you will be having the records in your EMR, you will be having that with you.
You will give it to the patient.
We have that OP ticket,
Okay.
and we probably will document it very meticulously in the OP ticket, and next time the patient comes there, that OP ticket is not there. So I think nowadays we are all sort of documenting it by keeping photographs, but it's also on an individual basis. So this thing is something which I find we need to evolve some sort of a protocol there. Another thing that we are in such potentially problematic cases, what I personally feel is that, and I advise the PGs also, that these patients can be admitted even for 1 day. Even if they go after that day, you can always write discharge against medical advice, but all those records will be there. So they will be having a record like that.
Otherwise, you will hand it over to the patient and they will, they will say, I didn't get anything.
Yeah, so many of these documentation in the OP ticket and they disappear sometimes.
I will tell one experience that we had a small corneal tear, small one suture under topical, one of the surgeons did, and discharged the patient, just like a cataract surgery. Next day, patient came with endophthalmitis. So, if possible, please admit any trauma for 24 hours at least. Right? Hello, sir. Yes.
That is another problem with this thing. Most of the injuries comes on the last patient. Most of them, they comes as the last patient also sometime.
No. This is a last patient on Saturday evening.
Yeah. So that is what, sometimes the injury must have happened 2 days before that thing.
Yeah.
So we also will have a lethargic time on that thing, and we tell that they have to come on next day, but we have to be like a documentation. I still remember one of the insurance case. It was not against us. When the insurance company was trying to deny it. And finally, this person has shown a photograph in their product. There's a lid tear, there is a small corneal wound, patient had this thing. And that photographer, the judge took it, and this is a very serious injury because he cannot understand what is cornea, uvea and all. By looking at this thing, he was telling the insurance person, so you have to give some compensation. Because the photograph is always very impressive.
And one thing, Biju sir, normally in private hospitals and all our setups, we face patients who come with some injury. And later they say that it is what you say, they had some tussle with somebody or somebody hit them and they come for medical certificate and all that. And we in the first place have not informed the police also. Or how do you manage such situations and what is the protocol? Just
That
for
is wound certificate
wound
and
certificate.
police intimation. That also you can comment.
You comment, yeah.
The thing is that, I mean, we get the history from the patient. We are not detectives or anything, you know. So that is not in our purview. So we take maximum care in order to get a proper history. And if the patient particularly denies that, that is not that we just document in the OP ticket that there is no MLC. Patient says there is no, he doesn't want any. For example, if it's an accidental fall or something, it's not an RTA, no case asked, told by the patient. So that is documented. That is all what we can do. Other than that, we cannot go after all these things.
There was a case where husband hit wife. Wife had a trauma. She said no case. After 1 year, it ended in a divorce and then she wanted a case.
Yeah, but it is documented.
So this is documented. We can't do anything. That is.
This usually happens actually. Most of the time they comes with some accidental thing, they will tell that. Only thing is, we have to write down properly what the patient tells. And next day or after some time, the police will come about, because they must have gone. Then I used to give it clearly. This is according to the history presented on this day. This is according to this clearly. But only thing is, you should be documented very well what the patient told in the initial this thing. So then it will act against him. That is, we will be a little more safer.
Another thing is we can
As
actually
alleged by the patient like that, you always write like that. The only thing is that, I mean, you always write it's an alleged history, as alleged by the patient. So that is what we write. And one thing is that, as Mahesh said, many of these patients come back telling that you need to actually, I mean, sort of modify this because now I want to go for a case. So that is sometimes we also try to sort of facilitate that and try to modify that. That I think is not very advisable.
I think we should not, if the patient comes and tells me about this thing, what I used to write it in the clearly in the case sheet. Now today patient is telling that it was an assault by this thing, and that will be properly
that also will be
documented.
documented. I think we can record
clearly
in our
documented.
phone. Whenever we are counseling, I do bad cases or extremely difficult patients. There are some very difficult patients who will not listen to anything. So those cases I record in my phone. That also is, I mean, like they record our conversation and put it. So why can't we record?
I think video
very
consent
easy.
you can take. Video consent.
Video also, video consent we
video
can
consent
take.
you can take actually.
So,
That is admissible in
I
court.
do that now. My own phone.
So you always keep a copy of your reference letter. That's
Absolutely,
it.
absolutely. So these are some of the cases. Police intimation, many of the government hospitals is not a problem. Police will come and take the wound certificate book whenever they want. But in private hospitals, you have to do police intimation yourself. Take it to the police station nearby. Okay. Now coming to the third scenario is pediatric cases and ROP. It's a special group, pediatric, because many of the presentations will be delayed. There will be difficulty in examination, difficulty in documentation, and there could be a delay, especially in trauma case due to general anesthesia. Patient has come in the morning with the full biryani and then we will do it in the next day only. So, and poor communication. Many times whatever you tell may not enter the mother's head. So these are some of the cases. And plenty of cases are there regarding pediatric litigations. This was against Shankar Nethralaya way back. This happened in 2001 when we were there, 2000. So this, in spite of a good workup by a cardiologist and proper, patient had a cardiac arrest during anesthesia in a skin case, and the court findings were physician's failure to investigate murmur despite congenital anomalies, improper atropine timing. So just imagine what all court is looking at, the details, improper atropine timing, call-in use, exacerbating, so these are all rushed surgery. The surgeon had 16 cases and this was the 16th case. Despite delay in schedule, the child was fasting from morning, record keeping inconsistencies. 1 crore was given against the hospital. So this is one other thing. Then ROP, I don't have to tell, tomorrow there is a session on ROP, you can attend that. The highest compensation in litigation is in ROP. because it is a irreversible blindness that's happening in the child. And most of the ROP litigations are for not advising screening or not doing screening. It is not that you operate and still patient does not have vision. So that is the standard procedure. So be very careful about the standard procedure. So anything regarding pediatric trauma, Jain and Ashok?
I think Jain has explained about 2,000 rupees and 20 lakhs.
Yeah.
When you consider the pediatric thing,
I think one crore is enough. 1 crore is, those doing pediatric cases here, please enhance to 1 crore at least.
Yeah, you have to take an enhanced PP scan, you get a protection of 1 crore. Yeah. Another thing is the child can take you to court up to till the child attains 18 years of age. Other cases there is a limitation period of 2 years. So, but in pediatric cases you have to be careful. The case can come up till the child becomes 18.
That is 20 years later patient can.
No, I think from 18 years limitation
Again
will start.
2 years. That means up to 20 years
18
the
years
child.
limitation will start, so 20 years.
Once the patient becomes major at 18 years, he understands that there is something, somebody screwed my eyes.
And one thing you have to understand, the Consumer Protection Act of 2019, they have specifically said that limitation period can be condoned in individual cases. They have specifically mentioned.
So it is 2 years is not
and
a
all
rule.
is like nothing. And second thing, there was a recent judgment in the Supreme Court where in PGI Chandigarh, a squint surgery somebody did. And after surgery, squint surgery was not working and the squint, not squint, total surgery.
Deteriorated.
Yeah, deteriorated. And the National Commission gave a verdict against the doctor, but the Supreme Court said that
Condoned. I am discussing that tomorrow.
worsening of condition after surgery doesn't mean that surgery was done badly.
So
that is something we have to-
don't worry about endophthalmitis or loss of vision or eye become thicycle. Do it in a step-by-step, documented, timely manner and communicate properly. So the result is not the thing that will decide the judgment. So that is high compensation pediatric cases. Just last one scenario is intravitreal injections. Nowadays a lot of people are giving intravitreal injections and without any proper indication and proper follow-up. So and there are n number of cases against the doctors, like giving Avastin because it is an off-label medication. Now there are guidelines saying that Avastin should not be used. Now there are a lot of other options available, so Avastin is not justified. So off-label versus approved, whether you need a fitness for injection, these are some of the points. Consent for each type of this thing and documentation. Any comments, Ashok?
Concern, now the new CPA 2019, they have said that not mentioning something is also negligence.
Yeah.
See, suppose you have said after intravitreal injection, you will not have rectal detachment. Suppose you are not mentioned in the consent, and the patient develops rectal detachment. So the patient will say, I didn't know that I will develop rectal detachment. If that was a complication, I would not have given. So, it is better in the consent to mention these are the possible effects.
All serious adverse events, even if it is rare.
Yeah, you please.
That's why if you see the AOS consent book, sympathetic ophthalmia is there in the consent. I thought we have never seen a sympathetic ophthalmia for past many years.
Yeah, like in medical college, Rakta Samardham, Rakta Sravam, Maranam Vare Sambhovikya. Like in medical college, all consents are like that only.
Yeah.
That is, the basis of that is this one, actually.
So when somebody is using Avastin, little be careful. You take a proper consent for Avastin. What is off-label? All these things has to be mentioned, because there are now alternative, cheaper Indian-made medicines. That is the thing. So this is any questions from the panel? I will wind up and give it over to Ashok Nataraj. He has a more legal side now. Any questions? Yeah.
About that fitness for injections, is it necessary?
That I didn't. Some people do. Now there are two situations. One is cardiac patient. Okay, cardiac patient. Some people blanket take consent from the cardiologist, but that is not the right method. I think I don't take consent for cardiac. But now there is a new threat that all these nephrologists are giving opinion against injections.
Yeah.
Injections. They are telling it will worsen the kidney function. And
No, the point there is, like, there are a group of patients whose creatinine is high, but they have not gone in for dialysis.
After your injection, if
They go for dialysis, they say it is because of that. So in those patients, I generally now avoid anti-VEGF.
So I give anti-VEGF even if the cardiac event, if the cardiac event was beyond 3 months or 6 months, I do give. But in the consent, it is written that very rarely it can cause this thing. In the consent, it is there. But I don't take, if the patient is too finicky, then I will tell you get a consent. But the problem is cardiologist doesn't know why we are asking the consent. They will write patient is fit for surgery under local anesthesia, avoid globulate.
They are just.
That is the usual reply we get.
Yeah, they are just mentioning about the procedure only. They are
That's
not taking care of the, I mean, they are not even thinking about
the anti-VEGF is creating a problem with nephrologists now.
Yeah, that is all. And even if you have to take consent, I think it's not required for every injection, is it? Like
The
if you have to
fitness,
give 3 injections.
Fitness.
Fitness.
No, only selected cases you can decide.
Yeah.
No, patient is very sick and, but in very sick patients already on globulate, nothing will happen. It is for healthy some people that.
And for intravitreal injection, it is not necessary that you need to stop antiplatelet also. Even without antiplatelet, you can give.
Yeah.
For intravitreal injection, it doesn't matter.
So you don't need fitness, that is what I feel. There are some hospital policies. In our hospital, we don't take fitness for all.
But we haven't actually developed the correct protocols for this, whether fitness is needed. Suppose this goes to court. For any standard procedure, this thing is that you should have a consent. So wouldn't the court equate this is also a procedure, this with a consent? So if there's no consent, then you can be penalized, right? So isn't it safer to take a consent?
Fitness, you are talking about fitness?
Yeah.
Fitness.
Fitness and consent.
Fitness?
Consent is always a
Consent is
must.
always there. Okay.
Consent is always there. Fitness, it depends on in your hospital, probably the cardiologist or physician, either you can always send and get a fitness. But I don't know, each hospital has a policy. We take fitness if our so-and-so condition, we take fitness. It is written in your SOP, no problem.
Yeah,
That's
so
what, each hospital can have their own protocol. If you say this was what we have been following for all the patients that is coming to the hospital, that is well and good.
So in our hospital, 3 months is the fitness duration. Yeah. After 3 months, again you have to take another new fitness, something like that. That is nothing standardized. It depends on your own.
Yeah, but in such cases, your hospital should have a standard protocol, which should be there. That SOP you should have in black and white.
Mahesh sir, one question. When you were talking about regarding taking the consent or any difficult cases and all, we are talking regarding that audio consent or the video consent. So how authentic it is? Like last day I had one case, one lady was totally thrashed by her autistic child with bilateral vitreous hemorrhage with lots of subconjunctival hemorrhage. You don't know who has beaten her, whether it is her kid or whether it is her husband. So according to how Radharaman sir have told, we have taken a consent. So the audio consent along with the video consent, and whether you need to record the eye condition and also that maybe some 2 to 3 years later we should not be in trouble. So how authentic is your recording the audio and video consent?
It is actually, if some patient comes back to you and said, not for this case, you are not told like that, then you can have this. I have told you all these things are there. I am not telling, but court can do a forensic evaluation and say whether you have tampered with your audio consent. Audio consent will add up to this. It is not a final this thing, right?
Yes.
No, the records are supposed to be kept till 3 years. So you should keep these records also, even if it is audio and record.
No, it's not 3 years. Keep it for your lifetime.
Lifetime.
Because, I told you,
Just attach it to the EMR.
there is no limitation period. Even after 10 years, I will show you one case. Even after 10 years, they can give a case against you.
Because court is always sympathetic to the patient, not to the
Consumer
doctor.
court is for the patient, not for the
It's
doctor.
for the patient.
Yeah.
So you can always attach the audio, whatever you have described, to the EMR and then